Bone marrow is a soft, spongy tissue in the center of bones that produces white blood cells, red blood cells, and platelets. Bone marrow transplants are life-saving treatments for people with leukemia, lymphoma, and many other diseases.
Good morning. I'm going to talk about bone marrow transplants, and specifically the bone marrow transplant that I had in summer of 2000. In spring of 2000, I was diagnosed with leukemia, acute lymphoblastic leukemia, and the particular variety I had meant that in order to save my life, I needed a bone marrow transplant.
For a patient's body to accept these healthy cells, the patient needs a donor who is a close match. 70% of patients do not have a donor in their family and must find one through the National Bone Marrow Registry. When you join the registry, you give a sample of cheek cells to be tissue typed. These results are used to match you to searching patients.
We identified both of my brothers as donors for bone marrow transplant. You have a 1 in 4 chance of matching a sibling as a donor, and you have a 1 in 4 million chance of matching anybody else in the general populace. And so I was fortunate having 4 siblings, and my 2 brothers matched me.
First, patients undergo chemotherapy or radiation to destroy their diseased marrow. Then, a donor's healthy marrow cells are given directly into the patient's bloodstream, where they can begin to function and multiply.
And then I received a intravenous infusion of stem cells from my older brother, which I call it magically go from the blood stream where they are introduced into the body into the bone and form new bone marrow, which is really it's my brother's bone marrow that then forms in me. I spent almost 4 weeks in the hospital where they keep you pretty isolated and you're under a lot of medications to make sure that the transplant takes, and that you also, you basically don't have an immune system, and so you're isolated. You've had, it's pretty, you're pretty sick at the time, and so I had a lot of medicines. I was taking over 60 pills a day and was being fed intravenously, and eventually after about 3 weeks they determined that the new bone marrow had been accepted, and so I was on a pretty intensive exercise program to start rebuilding my strength, and then after that I was discharged from the hospital, and really the recovery period from that is about a year before I was up to maybe 90% strength.
Patients are more likely to match someone of their own race. Today there are simply not enough registry members of diverse racial backgrounds. Adding more diverse members increases the likelihood that all patients will find a life-saving match. Your heritage can make all the difference. If you are from one of the following communities, you are especially encouraged to join the registry and donate: African American, American Indian and Alaska Native, Asian, Native Hawaiian and other Pacific Islander, Hispanic, and multiple race.